Habiba Grimes,
Present.
and Rabbi Joshua Caruso is excused today. He sent me an email that he unfortunately is unable to make it, but indicated he would watch the recorded live stream. So let me just check if Laura, are we live now? We are live. So we are live now, so we can proceed with the meeting. In case we weren't live, all that's occurred thus far is a roll was taken, and we do have a quorum. I'm going to take a moment of silence and reflection. I'd like to reflect upon the life of Dr. Susan Moore. In late 2020, Susan Moore, a Black medical doctor, died of complications from COVID-19. 2 weeks prior to her death, she posted a video while hospitalized, which detailed her disappointment regarding the treatment she received as a patient at Indiana University Health Hospital Systems in Indianapolis, Indiana. She explained she had to beg the physician treating her for an antiviral drug. The doctor denied she was short of breath after she told him she was. She was also initially refused pain medication despite her complaints of discomfort. The doctor told her he could not justify giving her narcotic painkillers. Eventually, after a scan detecting pulmonary problems, she was provided the painkillers. This case has generated outrage and renewed calls to address biased medical treatment of Black patients. As we have discussed, research shows Black patients often receive disparate treatment when compared to their white counterparts. COVID-19 has had a particularly devastating impact on the Black and Latinx communities. Black people have died at 3.6 times the rate of white people, and Latinx people at 2.5 times the rate of white people, according to an analysis by the Brookings Institution. According to the COVID Racial Data Tracker hosted by The Atlantic, which is a collaboration between the COVID Tracking Project and the Boston University Center for Anti-Racism Research, as of March 7th, 2021, the nation had lost at least 73,462 Black lives due to COVID-19. As we continue to battle the coronavirus pandemic, it is important to remember how disparities have shaped health outcomes for Black and Brown citizens, and how equity must be incorporated into future healthcare initiatives, including efforts to vaccinate Cuyahoga County residents. Let's take a moment of silence and reflect upon the life of Dr. Susan Moore. Okay, thank you. I'm going to move into the public comment. Since our last meeting, we received 2 public comments that were submitted via email to equity@cuyahogacounty.us. I forwarded the emails to the CACE's members on March 3rd and March 31st. Additionally, on February 17th, Ms. Phyllis Benjamin emailed Laura Black from my staff directly. In the email, Mrs. Benjamin provided information regarding the Office of Civil Rights and requested Ms. Black share this information with the CACE members. Ms. Black did so. As I mentioned during the last meetings, members of my staff always acknowledge receipt of each comment received via return email, and for those who request a meeting, Chair Taylor and I meet with those individuals. Chair Taylor, would you like me to read any of the acknowledged correspondence, both of which are very brief?
Please read them both into the record.
I'll read all 3 actually, including the email directly to Laura Black. I'll start with that one. Phyllis Benjamin on Tuesday, March 2nd, 2021 at 2:36 p.m. sent Laura Black from Cuyahoga County Clerk of Court's office an email, and in the red line, it said CACE schedule plus. Please keep me informed about the scheduled meetings for CACE. I am eager to continue to follow and learn from these knowledgeable council members. I am sharing reports so that your recommendations for anti-racism can be addressed by community members. Also, I want to know how to find the meeting minutes. When will the report about our courageous conversations be available? Thank you, Phyllis Benjamin. The additional email that she sent was Wednesday, February 17th, 2021 at 11:15 a.m. Dear Laura, I've attached information about our nation's Office for Civil Rights. Perhaps Ms. Bird and Mr. Taylor would be interested in sharing this description. If needed, I can also forward, quote, the top 5 things to understand about diversity and inclusion in the workplace, close quote, written by Professor Diana Villamoria, the KeyBank professor and professor and chair of the Department of Organizational Behavior, Weatherhead Case Western Reserve University. Is there a date for the next CACE meeting? Best wishes, Phyllis. And lastly, Ellen Schneider on Wednesday, March 31st, 2020 at 7:09 a.m. wrote, and in the subject line it says DEI. I do not want my tax dollars to be used for this racist propaganda. Anything resembling so-called critical race theory, which is in quotes, is nothing but racism itself. It is hateful and does not belong in 2021 government initiatives. And that was sent from her iPhone.
So thank you for that, Clerk Bird. And if any case member feels inclined to respond to any of the questions or comments sent to this group, this council, certainly feel free to do so. And as a reminder, based upon the number of these questions, the length of the questions, the amount of time it may take to read them, and of course the appropriateness of such questions, because we certainly want to still be responsive in that way, we will attempt to read one or a few or all of the questions that come our way, but it all sort of depends. But more than that, every question will be available for public review. Again, appropriateness matters, for public review through some media, the media established. So I just want to make sure that following our last meeting, and Clerk Bird is accurate, we made a determination that individuals who did offer comments should be heard on some level, whether it's through electronic media or this forum, and perhaps even both. Any questions or any need to respond to what was heard from a public comment standpoint? Okay, great.
Okay.
Thank you.
We'll move into the message from the county executive. Executive Budish, would you like to open the meeting with comments, please?
Sure, my pleasure, and good to see you all again, and thanks again for all your excellent work. The thing that's been occupying us mostly in the county has been vaccinations lately, trying to get people vaccinated. And on that score, I think we're doing very well, much better than many of our colleagues around the state and, in fact, the country. As of last week, we were up to about 450,000 Cuyahoga County residents that had been vaccinated. That's 450,000 residents, not, that's everybody, which is something like 35, 38, 36% of the county residents, which is good. Part of the reason for our getting such good numbers is the mass vaccination center that FEMA and the governor chose to put here in Cuyahoga County, which has had 120,000 people come through and get vaccinated as of last week, which is also excellent. The bad news is that of that, only about 9% were African American. So despite the fact that the site was chosen for its proximity to minority areas, it has not generated the kind of response that we all had hoped for. And the county's been very busy trying to improve those numbers and get more people out. So the county, among other things, has hired more people for our 211 line, where people can call and get registered. People can call and sign up for free transportation to the Wolstein Center. We're paying for the transportation. So we're trying to take away the barriers to coming out. The good news is that since the Wolstein Center is open, the percentages of folks in minority communities getting vaccinated has shot up. We can only do it by zip codes, but because that's the way the state records the information. But just to give you an examples, the people living in the central neighborhood zip code, percent of African Americans getting vaccinated is up 71% in the last 3 weeks. In Kinsman zip code, 77% increase in 3 weeks. Collinwood up 80% in 3 weeks. And Fairfax up 92% in 3 weeks. So we are going in the right direction. We still have obviously ways to go. Not only are we working through the Wolstein Center, but we're also trying through our Board of Health to get vaccinations done in the communities. So there have been a couple times that the Board of Health has been out to the Word Church in Warrensville. The Board of Health has been out to the Salvation Army a couple times in East Cleveland. And, so those are examples of what is going on, and more efforts are underway. So we're doing all we can. We are working with community partners and who have been very helpful. Church leaders have been very helpful, and certainly any suggestions from this group as to how we can even accomplish more, we'd certainly be open to. I think we're all on the same page where we want to go. The other thing that I'll mention in my remarks is how we're addressing the digital divide, which has really been highlighted as a significant issue, a significant equity issue since the pandemic started. And again, we're trying a whole lot of things to try to bridge that divide, particularly in minority communities. And I'll just mention that last week was the latest effort. We were out in East Cleveland. The governor came up, the lieutenant governor came up. Marcia was there. Thank you, Marcia. The Urban League has been a good partner with us. And we were announcing a program that will extend low-cost, accessible internet service to 1,000 homes in East Cleveland, and that can be expanded. So that was a true public-private partnership. Not only was the city and county involved, but nonprofits like Urban League and Eaton was involved, and General Electric Lighting was involved, and others. So efforts are being made and strides are being made, and I'm optimistic that we'll continue to show progress in tackling the digital divide. The last item that I would just mention is the really bad news, and that is that Eliza Wing, who's on here today, our Chief of Communications, has been involved with this committee. Will be her last meeting with this group, I think, unless she wants to continue to show up. But she's been very helpful in many of these activities, and has been a great advisor to me as well. So say goodbye to Eliza as of this meeting.
Well,
Thank you.
we'll say goodbye in this forum, but we will certainly have an opportunity to hear from Eliza in just a moment. She's going to provide a report a little later in the agenda, but I join you, County Executive Budish, in indicating and strongly supporting the belief that notion that Eliza has been wonderful for the work of CACE. She and her team have stepped in at every turn to not only say yes, but to deliver upon the promises made. So thank you so very much, Eliza. You will be missed. Again, we will hear from you in just a moment, but if you want to accept our congratulations.
Yeah, no, thank you, Eddie and Armin. That's really sweet. And it's been amazing to work with this group. What you're doing means, I think you know this, it means so much to me. I just love watching what you're doing and the efforts and supporting you, and you'll continue to have the support of the team that's here. So thank you.
Please also know, Eliza, 2 seconds, you know how much I do as well value you and our relationship, getting to know each other and work together with this. So you will be missed by me, but not gone from my life. So thank you for your work on behalf of just my staff and helping us and you and your team.
Thanks, Naila.
Of course. Chair Taylor, would you like to address the council, or would you prefer that I dive into the new business?
I will address the council for just a few short moments. Of course, you've heard that you will momentarily get a report from Eliza on some of the youth conversations. You'll hear from Clerk Byrd on a few issues. The community dialogues we've had, we will both tackle some of the issues around the DEI work, not only the RFP, I believe it was, that went out for countywide diversity, equity and inclusion training, but the budget and some other things associated with it. But I should start by saying it's, again, regrettable that we are down a member of the Citizens Advisory Council on Equity in Phyllis Harris. Phyllis Harris certainly was one of the original members, and she indicated she wouldn't mind me sharing that she was, in her view, compelled to resign because of family health issues and other things that are confronting her right now. She just felt the time and the need to deliver attention and care elsewhere would pull her away from this work in a way that was unfair to the work, to you, and to herself, of course, and her family. So she couldn't have been more appreciative of all the good that's been accomplished. You know, of course, not only being on the CACE was her role, but she chaired the communications efforts for us as well. So hope you join me, and if you have an opportunity, to wish Phyllis all the best when you see and talk to her, but also believing that she was instrumental in all the good work we've started and accomplished to this point. Okay.
Okay, thank you. I'm going to move to the approval of the minutes. On February 26, 2020, the minutes for the February 9th, 2021 meeting were distributed for your review and comment. Do we have a motion to approve the minutes?
Motion to approve, India Lee.
Thank you. Is there a second?
Second, Randy McShepard.
Thank you.
Marshall.
Thank you. Is there any further discussion or any discussion at all? Seeing and hearing none. All those in favor, please signify by saying aye.
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 Any opposed?
Aye.
Hearing none. Any opposed? Okay, hearing none, the motion carries and the minutes are accepted. As Chair Taylor mentioned, an RFP for countywide employee diversity, equity, and inclusion training was sent out, and I'm very happy to report that. The purpose of the RFP is to develop and execute a training and education strategy to increase the awareness, knowledge, and skills of Cuyahoga County staff, boards, and commissions as it pertains to diversity, equity, and inclusion. Through this training, policies and programs can be implemented and executed to better achieve equity. Initial recommended trainings as detailed in the RFP include cross-cultural training and supervision, undercovering unconscious bias, bringing an individual and systemic lens to race, racial equity, and structural racism, and exploring the intersection of race and other identities. To quote Executive Budish, and I quote, "This proposal for DEI training recommended by the Equity Commission and the CACE is so important to the success of our county and our long-term goal to enhance equity both in and out of our organization," close quote. The RFP will be open until Wednesday, April 14th at 11 a.m. and can be found on the Cuyahoga County website. Included on the panel to review responses are myself, along with Assistant Director of HHS, Leon Harris, Chief Economic Growth and Opportunity Officer, Matt Carroll, OPD, Department of Procurement and Diversity Director, Lenora Lockett, Human Resources Talent Management Director, Deborah Johnson, and Planning and Program Administrator, Nicole English. My staff have already distributed the press release and further information regarding the RFP to all of the members on March 17th. Is there any discussion or any questions about the RFP?
Not a question necessarily, Clerk Byrd, but a request to County Executive Budish and to Clerk Byrd. We recognize that the county will pay for the work to be done by the successful consultant. We also recognize that it serves internal purposes to begin with, but I think it'd be wonderful, not that there's any approval that's necessary or needed by this group, but it'd be wonderful if one or two members were given an opportunity to at least see some of the responses if you get several responses from a few qualified vendors in this respect. So again, not an approval authority or agency, we recognize that, but the opportunity to review the work submitted in an appropriate setting would be the request if it's at all possible.
So I will, of course, defer to County Executive Budish and to Andrea Nelson Moore, who's on the call. And I believe that once those responses are submitted, they are public record. Is that correct, Andrea?
I am under the understanding that once it has been awarded, then a person can request a public record of all of the submissions. So let me get back with you. As a matter of fact, I can research that as we're going along, and I'll get that back with you so that you can share with the other case members.
That would be awesome, because I think that would be what the issue would be, Eddie. As long as it's a public record, I don't see why we wouldn't be able to share it. But I will, of course, defer to Executive Budish. Executive, what are your thoughts?
I understood Eddie's question as to whether there could be one or two members of this committee on the evaluation group. Was that your question, Eddie?
That's where I was leaning. I just wasn't sure if it was permissible, but certainly that's where I'd lean.
And then I apologize, Eddie. I heard it very differently. I heard you were just asking to review the responses and not seek the approval or participation.
Well, again, if they could be in the review, I don't want to complicate it, but if they could be in the review process, perhaps not have a vote, that would be acceptable as well. There are experts on this call who know this work, who've done this work, who've seen what good looks like. So at some point in this process, we'd love for those individuals to at least be able to eyeball responses.
Good suggestion. Well, I don't know if the committee's already been selected or not. I don't know who's on it, if it has been. So I'll certainly relay that request.
The committee has been selected, Armin, and I can relay it since I'm one of the members on that committee to review the responses if you like.
Great.
Thank you.
Okay. How many members, Eddie, would you be looking for from this body?
The answer could be 0. It could be probably no more than 2, depending
Okay.
on individuals' interest in reviewing the information.
Okay. Why don't we move on to the equity fund budget? As you may be
Just a
aware.
quick question before you
I
move on.
apologize. Yes.
I'm sorry. What's the due date for the RFPs?
The RFP is going to remain open until Wednesday, April 14th at 11 a.m. So
And can you say whether or not we've had a decent response up until this point?
I could say if I was aware, usually as a member of the panels, when I've been on them in the past for other RFPs, I don't know how many people have responded until I get the packet of information on a zip drive or a drive from the person. So I don't know if there's been any responses to date. I can find that out and send you that communication in an email, though, if you like, after.
Yeah, just in the event that it's been a trickle, it might be in our best interest to try to get, a final push out to ensure that we do have a good number of credible, prospective consultants, throw their name in the hat.
Laura's going to send an email right now, and hopefully she'll have that. She'll get a response before the meeting is over, and I can provide it to this committee member, McShepard, if that's suitable for you.
That's fine. Thank you.
Sure. Any other questions for any of the other members? Okay, seeing none. As you are likely aware, the county executive and Cuyahoga County Council allocated $500,000 to the 2021 budget to fund equity-related initiatives. Chair Taylor, would you like to provide an update on your discussions with the Equity Commission regarding this budget?
Thank you. Yes. So we know some great news has come from not only the generosity in this respect offered by the county executive to create a budget to begin with, and we know as well that this is not the final say in terms of how much in terms of resources might be allocated to the work that we're doing, but it's a great start, and that start is in part fueling the RFP process we've started, or that is underway, but also some staffing and other resources, not in whole, but in part, will flow from this budget amount. So we are excited to begin with. As we've said, this is a start to the process, but so many of the recommendations made by this advisory council are being carefully and thoughtfully acted upon by the county executive. Resources have been applied to the work. And as it turns out right now, the budget is still in formation, but we believe, as mentioned, good outcomes will result from this entire effort. Any questions? All right.
Okay, hearing none. As the executive mentioned, on March 17th of 2021, the Wolstein Center at Cleveland State University began serving as a mass COVID-19 vaccination clinic. The site will be active until mid-May and is operating 7 days a week from 8 a.m. to 8 p.m. From March 17th through April 26th, the Mass Vaccination Center will offer only second doses of the Pfizer vaccine. Then beginning on April 27th through May 10th, patients can receive the single-dose Johnson & Johnson vaccine. The United Way's 211 is staffing special COVID operators who can assist people with registration and connect them with free transportation resources. Our partners at local libraries are also available to assist with finding appointment availability and scheduling for those who do not have computer or internet access. Registration is now open at gettheshot.coronavirus.ohio.gov. The county, as Executive Budish stated, is encouraging anyone who is eligible and interested in being vaccinated to take advantage of this opportunity. Before moving on, I'd like to also underscore the need for our continued outreach efforts to the Black and Brown residents of Cuyahoga County regarding the vaccination. The county is continuing to mobilize its resources to communicate with the public regarding the availability of vaccinations. Since March, the county's Department of Health and Human Services and Office of Emergency Management have sent approximately 94,000 robocalls and text messages to HHS clients with information on how to register for an appointment and get free transportation via the United Way of Greater Cleveland's 211. They are currently launching a second round of robocalls and text messages, which will target more than 100,000 residents. Health and Human Services has also coordinated distribution of more than 6,000 bus passes to various locations throughout the county for residents to have free transportation to any vaccine appointment. The number of vaccines, as a county executive went over, and I won't repeat it, is administered in the vulnerable areas. Many with high population of Black and Brown people continue to be much lower than other areas of the county. So please, and I underscore please, let's work to continue to get the word out to the Black and Brown community of the importance and criticalness of getting vaccinated. Any discussion or questions?
Question would be for you, Clerk Byrd, and for the county executive. Certainly the 9% vaccination for the African-American community is woeful. We would all recognize and accept that. But we've heard pockets of excellence, a 71% increase here, a 90+% increase there. We've heard some of the methods for outreach, include transportation and the probably digital outreach and of course mail and phone calls. What has worked especially well, if we know, and perhaps you don't know, but what's worked especially well so we can, fundamentally keep these 71% growth spurts going and move well beyond the 9%? Are there pockets of excellence that have been pointed to in this work? And perhaps one of the council members might know this as well, Dr. Gullett. But just curious, what's so far been effective or the most effective?
Executive Budish, do you want to go ahead?
I see Heidi. I see Dr. Gullett getting closer to her microphone, and she probably knows even more than I do. So I'll let Dr. Gullett go first, and then I'll follow up.
And Danielle has a hand up as well.
Danielle, did you want to go before me?
No, I had questions, so I'll wait, Heidi, because you might address them before I ask.
Okay, thanks. Thank you, Chair Taylor, for the important question. So that 9% was 9% of the vaccines provided at Wolstein. If you look at the county data that the state has, so all vaccines, whether they're given through a healthcare provider or by public health or by the FEMA site, have to route through the state system. And so the state has pretty accurate vaccination numbers. So about 19.6% of the community of Cuyahoga County who identifies as Black has been vaccinated. Now that's all based on prior census and other survey data for that denominator of population. So that's still not adequate, but just to give you a sense for the difference in the numbers. There also is a fair number, I think about 14,000 shots where the race and ethnicity are unknown. So that's another variable there too. And early on, it wasn't collected in the way that it is now. So one of the things that has been really effective has been using leaders within neighborhoods and within communities who are trusted. So that includes religious leaders, that includes healthcare providers, community health workers. So it includes people who have trusted relationships in the neighborhood. Our community health centers have been remarkable in the effort to reach people within neighborhoods. And so that has been a really important piece of what's happening here, particularly for the approach where we're trying to reach people where they may not feel comfortable or want to come to Wolstein or want to come to a drive-through site for one of the health departments. So there are regular meetings as well of health department officials, hospital officials, and community health centers to look at a larger strategy that's equity grounded to ensure that we're actually using all of the lessons learned in real time to figure out what is working, because we certainly have not reached the equitable distribution of vaccine that is necessary. There are also pockets of other non-English speaking populations, as well as other minority populations, for example, from a religious standpoint, that have also had pop-up sites for vaccination, which have been fairly effective. Happy to give you more information, but in general, that's sort of the overview.
And I would just add, I agree with everything that Dr. Gullett has said. In the experience that I've had, the most effective has been going out to the communities, again, working with the leadership, the minority leadership out there. So the Word Church in Warrensville Heights has been extremely effective as a location. Salvation Army in East Cleveland has been effective as a location. I was just on the phone today with Dr. Macon of the Pastors in Mission about going out into different communities. We'll be probably addressing the pastors again for the second or third time on this subject next Tuesday. And I think that kind of direct contact has been the most effective. So, you know, we're going to continue to push that. I will also add that Dr. Gullett, as you know, is very active with the Board of Health for the Cuyahoga County. The Board of Health and the county have been doing bi-weekly press contacts, press media events, and the last few have focused almost entirely on vaccinations, getting the word out through those media. And through that, we do reach many thousands of people in Cuyahoga County to get the word out on the importance of the vaccinations. We've had one or two African-American physicians at those meetings talking about why it's important and the fact that it's safe. So, you know, we're trying anything we can. And again, you know, any suggestions people have, you know, I know the Board of Health, Dr. Gullett, we at the county would be very open to other potential suggestions.
Danielle?
Yes. So I had a couple of questions. One on the percentage increase, as was talked about in some of the communities. Do we have that translated into raw numbers? Because you go from 0 to 1, you have a significant increase. But when we say 71%, do we know how many people that actually is in some of the neighborhoods?
Yes, and it's all public. It's all online. If you, I don't know, I don't remember the website. It's the state's website. Maybe Dr. Gullett has that, but you know, you can go on that. You can just plug into Google, you know, county vaccination data, and you'll see the data will come up for Ohio.
Any general sense though? Is it a couple hundred? I mean, 20,000 people, 10,000 people? Do we have any estimate?
It's in the hundreds. It's not in the tens of thousands.
Okay.
So, Danielle,
go ahead, Heidi. I'm sorry.
There's 73,000, a little over 73,800 people who identify as Black or African American in Cuyahoga County have been vaccinated, at least one dose. But as far as the increase in certain neighborhoods, that micro information, the community health centers have been actually keeping track of the increases in very specific locations. And so I can certainly get you those data. They're usually presented once a week. I just, off the top of my head, I don't have any examples memorized.
No problem. I just asking just to put into context. Second is with the robo calls and text messages that are happening. I know I've done it for campaigns and other GLTV activities, and people usually can respond in some way. Are we getting any responses for folks that are not interested in taking the vaccine? Are they texting back? Are they saying anything? Do we have any information relative to that?
So I can answer that. I spoke with the Health and Human Services Director, David Merriman, and did not ask that question. I can follow up with him. I don't believe that folks are responding back to the robocalls because they are also targeting their stakeholders. But I will get that answer for you, Member Sidnor.
Okay, thank you. Final question is just, I guess, regarding the vaccine in general. I know that Marsha Maccabee and I are also having regular conversations with the state relative to the same topic. And one of the things that I feel like I'm beating a dead horse on that I'm going to keep beating is there is still a lot that needs to happen around the misinformation and the distrust, because I think that many people know that the Wilstein Center is available. They don't want the shot. And so our efforts to continue to make people know that the vaccine is available, I feel like are not as effective if we're not doing enough to convince people. I get at least 1 or 2 TikTok videos a day sent to me on how Bill Gates is trying to depopulate the society with the vaccine. So these are intellectual people who run businesses and do all kinds of stuff, and they don't trust the vaccine. I know we can't save everybody, but I think our efforts have to be maybe ratchet up a bit around getting people to understand which vaccine is available, why it is safe, and putting more money into the convincing part of our strategy besides just the awareness that the vaccine is available.
So Danielle, I think that's a really important point. And in some cases, the individual provider patient interaction is the place where that conversation happens. But that's hard to put at scale, and particularly with people who don't have a primary care provider, a trusted provider, that's difficult. The Cuyahoga County Board of Health just received money under the Racial and Ethnic Community Health REACH grant to specifically target vaccination, COVID-19 vaccination messaging. So that'll be a cross-community effort. There are a number of organizations involved, but CCBH is the one that received that funding because they are a REACH grantee. So they were eligible for that. That came through, I think, maybe a week or 2 ago. And I would be happy to connect you with the head of the Equity Advisory Group for COVID-19, Nichelle Shaw, and Levon Lee, who are co-leading that effort because they're the ones who are leading the groups that are coming up with the different messaging. So that is in process, but certainly we can't talk about it enough. And at the state level, it's really important as well. But locally, that's the group that's leading that.
Thank you. That's all.
And,
I'm sorry, go ahead.
To add to that, I believe, and I don't want to misstate, but I believe the county did have an RFP out, which was a little while back. And there is I believe, a ministers group that won the RFP and is doing, among other things, outreach, both through media and other ways to get, again, to communicate the sorts of things you're talking about.
Yeah, if I can just speak up, that's a cross-functional group across the foundations. I believe it's staffed by Mount Sinai Foundation, and the Cleveland Foundation and Gun Foundation are all involved. So that outreach work is supposed to be started.
So Marsha, do you have a comment as a final
yes, Chair Taylor. I was just going to add that a robust media campaign with Radio 1 is underway, in which the Urban League and NAACP are involved with some other partners, and that will be launching fairly soon. And that is more focused on telling the, directly dealing with the myth and the misinformation, the hesitancy. I mean, we know dealing with our community, and as Neil already said, it's more about not just where you can go get a shot. It's first trying to get you to understand, what are all of the facts about the shots, so that you can make an informed decision and dealing with the hesitancy. The other thing is there will be a town hall meeting around that. Also, when I received my last shot, and I'm thankful to our partners at Metro Health, I was able to have a video which will be coming out tomorrow, and sharing with my community that, you know, I've taken the shot, and, you know, encouraging other community members to do so. So I think in addition to the best practices that have already been discussed, that those that are underway that will be launching here within the next week to 2 weeks were worth noting.
I agree. So thank you everyone for those important questions and the comments. That detail is obviously critical for our community. So thank you so very much for that information. Let's move to the next subject.
Sure. Since our last meeting, the CACE received a preliminary draft of Cleveland State University's findings associated to the community conversations held in the fall. Chair Taylor, then Communications Subcommittee Chair Phyllis Harris, and member Victor Ruiz met with the Cleveland State University's Dean of the Maxine Goodman Levin College of Urban Affairs, Roland Anglin, and the students assigned to the project to discuss and provide initial feedback. We recently received a revised report, which was distributed last week to the CACE members for feedback. The 4-page report includes a summary of key themes discussed during the conversations. Some of the key themes identified include overrepresentation of Black and Brown people in prison, concerns about Black and Brown people's interaction with police officers, the absence of healthcare facilities in Black and Brown communities, perceptions of biases within healthcare systems, the lack of grocery stores in Black and Brown neighborhoods, racial biases experienced in hiring and career advancement, the lasting effects of redlining and gentrification in Cuyahoga County, limited access to technology in Black and Brown neighborhoods. A dominant theme throughout the report is the lack of access to critical resources, services, and amenities in Black and Brown neighborhoods. The participants also voiced that they welcomed and encouraged continued CACE-facilitated discussions and felt it was important to ensure youth and leaders of color are included in those conversations. The participants also believed community involvement was a critical starting point to restore trust and faith in the system and to build a sense of community. Dean Anglin and his team also identified specific shared experiences from the conversations, highlighting the inequities discussed. The stories shared describe interactions with law enforcement, healthcare providers, and educators. The findings will be incorporated into the CACE's next report to the community. Chair Taylor or Member Ruiz or any other member, do you have anything else to add or discuss regarding this topic or the report?
Before we open it up to others, I'd love to hear from Member Ruiz if he has any thoughts or comments on the report, the findings to this point.
No, I thought that was a great summary. I do want to thank Dean Anglin and his staff for looking over all the information we sent over and partnering with us on this report. And also Laura for the work that she did. So thank you, Chairman Taylor.
Thank you. And of course, from that list of findings, there are probably no surprises to anyone on this council, but and we're going to have many more discussions around this. Plus, we're going to, as mentioned by Clerk Byrd, put some of these findings in our next report. So there will be a fuller conversation, but any brief comments from folks as you hear that list read, even if you haven't read the 4-pager itself. Any thoughts?
Eddie, I wanted to, on another note, indicate I'm going to have to sign off, not for the lack of interest, but for a conflict in just a couple minutes. So thank you all very much.
No, well, thank you for your time. Appreciate it. Okay, all right.
Want to move on, Chair Taylor? Should I move on?
Let's move on. Yep, please.
Cuyahoga County is continuing its efforts to engage youth in the county's equity work. On March 24th, Executive Budish, Communications Chief Eliza Wing, Director of Regional Collaboration Michelle Pomeranz, and I attended a Look Up to Cleveland Zoom event where high school students reported out on their specific racial equity project. Additionally, the Communications Subcommittee is developing tools in conjunction with the county's communication department to facilitate youth conversations on structural racism. The toolkit is currently being edited and will be distributed to the full body once finalized. As was mentioned, we're here. Eliza Wing has joined us on the Zoom call. Eliza, can you provide any additional details regarding both the Look Up to Cleveland event as well as the youth toolkit for the members?
Sure. Although you did a great summary there. I mean, I think it's quite interesting that one of the conclusions from Dean Anglin's report is that youth do need to be actively engaged in these conversations because they're the future. And having transparent and open conversations across the county with youth is, I think, very important for this group to continue. So to that end, we have worked, Armand has worked through Look Up to Cleveland for the past few years, meets with them every year when the new class convenes. And just for background, for those of you who don't know, Look Up to Cleveland is part of the Cleveland Leadership Center. So they have Leadership Cleveland, and then they have Bridge Builders, and then they have Look Up to Cleveland, which is their high school class, and they pick kids from across the county who participate in learnings about government and the neighborhoods, and just it's actually quite a lot like Leadership Cleveland, but it's the high school version. And these are really great kids. So this year, County Executive Budish was able to issue a challenge to them in December. And he brought up the good work that you all are doing, that our internal commission is doing, and asked them to host community conversations just as CACE had done. And when we looked at the demographics for the community conversations that we hosted, I can't remember what that is, it seems so long ago, but for the 200 people, the average age was 45. So we knew we needed to do some youth outreach, and Look Up to Cleveland was a nice group to start working with. So we built a toolkit based on the community conversations platform that we had done, provided that to the Look Up to Cleveland class, and they hosted 6 conversations. And then they came back and presented to County Executive Budish in late March, as Nayla said. And we found a few different themes that we thought were interesting to share. They're very focused on curriculum. They want to make sure that structural racism and social justice is taught in the schools, and it is not in many cases. So that was something that was very interesting. They also recommended that we look at other states and counties to extract what's been effective for them in relation to social justice, and also wanted, to see Congress make some changes to laws. And then also continuing to invest money in underserved communities, and to use social media as a method of information sharing rather than as a potential outlet for bullying, which many of them said that's really what the platform has become. I see Habiba nodding her head. And reminding people that voting is power and helping people understand why it's so important. So those were some of the common threads. And then moving forward, as Nayla said, we are finalizing a community conversations toolkit for youth across the county. And Habiba Grimes has done outreach to many organizations that are connected to youth. And I believe that will just be continuing and really empowering people to have these conversations where we're not, or CACE is not the middleman, if you will, but also creating a kind of a feedback loop so that CACE hears what's coming from the community and is able, just as you were able to hear from CSU and as we were with Look Up to Cleveland, to get continued ongoing input from the community. So that's my report.
Thank you for that, Eliza. A great report. Obviously, there's a whole lot in there, stuff we knew, stuff we have to be constantly reminded of, but I know everyone turns to you in this situation for thoughts and input. Anything you want to add at this juncture?
First, gratitude to Eliza, Devin, Nayla for the efforts to engage youth and to do so intentionally and in an inclusive way. That's greatly appreciated. I think the youth have lifted up something important as they talk about not having curriculum or instruction that helps them understand how systemic racism and social justice intersect and impact their lives and the lives of their peers, their family members, and community. I think our own experience in the community conversations with the adults indicated that there's some work we have to do so that we're using shared language and coming from a shared place of understanding. So I'm excited to see that youth engagement continue and be part of supporting that in my own role as well.
Thank you. Any other?
Chairman Taylor, that was my question. It's always nice to get input from youth, but what are we going to do to ensure that those bright ideas are actually acted upon, that it's not just an exercise where you feel good because you heard from youth, but what steps can be taken or will be taken to ensure that those ideas actually get the legs that they need to result in something meaningful?
I mean, if I could speak to this very quickly, this is, I think, a main focus point for the subcommittee, the communications subcommittee, working through what kind of a platform intake and then again, reflecting it back out. But that is still being discussed, but you're absolutely right. It'll backfire if we don't have a good feedback loop.
Yeah, so main work in this subcommittee, and this work will be included in our next report. And if the results from our first report prove as any indication, we did see some benefits, some outcomes associated with that report. So we have to be just as clear and just as pointed this next round in our report as we talk about the youth. So yes, it'll include the comments from Dean England and that work. It'll include, maybe we'll get some additional empirical data, but we certainly have to talk about this loop that you both speak about with respect to the youth. So it has to be in there. And if it has to be in there, then perhaps additional action is generated, depending on the recommendations we make following the comments from these bright minds.
Mr. Chairman, have we identified a replacement for Phyllis to head up the communications subcommittee?
Well, you've gotten ahead of the agenda and perhaps one member on that committee, but we are still in process, sir. Unless private conversations can be revealed now by a member, but we're getting there.
I won't leave the council in suspense. I am considering taking on the role of chair of the communications subcommittee. Would really welcome some engagement with Naila around the support that will be necessary for me to do that competently in terms of the county's engagement.
So,
and Habiba, as
I'm sorry, go ahead, please.
I just wanted to share with Habiba, and I share this with all of the council members, and I hope we've proven that this is the case. Myself, Laura, and my team are here to support, assist, help in any way possibly we can. Although Eliza is leaving, Devin is not, and I will make sure, Eliza knows I will make sure that Devin continues to put a supportive role and will help us and facilitate and do what we can. So if it is from the county side, Habiba, we will work with you and do all that we can. And Eliza, I don't want to speak too much for Devin, but I do believe that, and I know you'll be gone and she'll be there. And I'm also certain that if I needed to, the chief of staff or Armin would provide us with additional support for this work if we needed another one of Eliza's former staff members to join us as well. I don't know, Eliza, if I've misspoken.
Yeah, no, Devin is watching this, and she is extremely supportive, and she's the one who's taking the lead on the final edit of the toolkit and the design and all of that stuff. And she really admires and supports the work. So you will have strong support from her, and she's great.
I think Chair Taylor would probably want to also, if Habiba does decide to take on the role, perhaps ask for another volunteer to join the committee, since the committee would then just be down to Habiba and Victor.
Absolutely. And the more the merrier. And I did see Mr. McShepard and Dr. Gullett did offer claps as a part of their reaction. Victor did the same. I'm going to add my clap to the screen to encourage Habiba to accept this role. I believe you.
Chairman Taylor, I thought that was a vote, not a clap.
Yeah, I'll interpret it that way. She's open. But anyway, so thank you. It sounds like we are moving in the right direction there, Habiba and others. And Naila's right. If we can get one or two more to join this committee, the work is important. As you heard in this next communication, we've got just as important ground to cover. So your thoughts are welcomed. Okay. Thank you, Habiba. Appreciate that. All right.
Mr. Chair, a related question, please.
Please. Yeah.
Are there plans to replace Phyllis on the CACE?
That is a good related question. That is in
and related to that, weren't there supposed to be additional county appointments?
Additional county appointments. We've worked through the mechanism, and I'll certainly Andrea and Andrea and Naila can respond, but I thought we worked through the mechanism in terms of how folks were appointed. I think there was a definite number, right? There was we reached a capacity, if you will. So I'll let them answer that question. The county executive, well, I guess they can answer both. The county executive and others are thinking through what the replacement process looks like. And I imagine it should have a sort of familiar look to what was done and conducted before, with county council having a role and others having a role around the suggested or nominated replacement, then the process undertaken from there. But no decisions yet. I would imagine suggestions, recommendations, nominations are welcome.
So I can speak a little bit to that and underscore exactly what Chair Taylor said, Mr. McShepard, is that the county is going to be replacing or selecting a person to replace Phyllis. That person obviously would have to go through, as Chair Taylor suggested, the nomination process and get the approval of council and be voted in. So that will happen because as the legislation stands, the committee consists of 17 people. To reference, I think what you were speaking of in the second half of your question is that there were 5 members of the CACE committee who recently went before Cuyahoga County Council to extend their term as the committee member, and they've signed on. These were the folks who just had a 1-year appointment pursuant to the legislation, and they agreed, thankfully, all of them, I'm very pleased to report, agreed to serve as additional 3-year term. Does that answer your questions, Mr.
Yes, thank you very much.
Okay. Chair Taylor, seeing no other questions, if you want to go into the subcommittee chair reports, that's what's next on our agenda.
Please, and first up is our Criminal Justice Subcommittee report. India. Is she?
So we are continuing interviews, the Criminal Justice Subcommittee, with various individuals and organizations to continue to gather input as well as best practices that are going on around the country. And we recently, well, just in an article today about Maryland, who is the first in the nation to actually repeal the state police Bill of Rights, which will be something for our committee to watch and follow over the next several months and see how this plays out and how that legislation was put together, you know, the different components of it. And it also gives oversight powers to civilians as part of that legislation. Just as we've been looking at New Jersey and some other really best practices, I think it's important. We've, like the rest of the other subcommittee chairs, have had meetings with various organizations, such as the South Asians for Justice and Equity and some others, to really hear from them about their viewpoints and what they're doing and how we align work with other organizations in our community around these efforts. So we continue to do the work, and when it also make an announcement that the Cleveland Foundation is looking for a senior fellow for criminal justice to begin looking and working with organizations on the ground, but really do a deeper dive into the criminal justice reform area. And if people need that, we're taking applications till May 1st.
That is great news. Chair Lee, can you tell us, I mean, obviously the job isn't filled, but what led to the creation of this role? Can you?
Actually, this is something our board talked about back in June when everything was going on, and we took time working with the Ohio Transformation Fund, talking with the Gun Foundation, who's been doing this work for a long time around juvenile justice and others, and did some homework on what would that mean. And so, you know, and then the CAC, this timing really just is perfect. To begin looking at how we can support, we're not leading, but how we can support others on the ground doing this work and what that means for this region. So it's a senior level position, 2-year fellowship, and, you know, really, really looking to support the efforts, not only of the organizations there, but the work we're doing here as well.
Tremendous. Any other subcommittee members have comments or any questions of India? Okay, hearing none. What a great report. Thank you very much. We know there's work ongoing, and we're going to have to get the subcommittees back in gear in terms of writing, right? It won't be nearly as exhaustive or as extensive this time around for the subcommittees, but it's still going to be important, and it's going to be an additive part of this entire process. So the work continues, but well done. Thank you. Dr. Gellert, healthcare.
Yeah, thank you, Chair Taylor. Like India said, there have been a series of meetings with different groups that included the subcommittee chairs. So that included the one that India mentioned, as well as meeting with the director and advisory group for Children's and Family Services, which really, I think, falls across. It's one of those many things that we do that falls across all of the different subcommittees. So those have been very helpful. We're also in the process of other interviews with other health leaders, as we outlined in our report, which was part of the larger report released on January 6th. I've also been very pleased that some of the recommendations we put in that report were read and followed up on. So we actually had a new member join the Community Health Improvement Planning Group from Cuyahoga County. So every 3 years, there's a Cuyahoga County Community Health Improvement Assessment and Improvement Plan that's created between health departments, county government, City of Cleveland government, and social service agencies, community-based organizations. And we had recommended that there be a Cuyahoga County representative as part of that. And so Sabrina Roberts has joined. And last week also, we had other representation as well from the county. David Merriman also joined us. So that's really important, because that's the linkage to the larger report on how we're going to improve the health of the community. And one of our biggest overarching strategies is addressing structural racism across all of those different sectors, with health as the lens. So it made sense to sit with Sabrina and with David. So I'm pleased to report on that as well. So the other thing is, across all the subcommittees, we're all continuing to work with Dr. Hoffman on the systems mapping piece, so that we can better understand how each of our pieces fits into the larger whole. So that's also a part of our work. So I think that's my report for now.
Again, as usual, great report. Thank you very much. Lots of work happening there. Any other subcommittee members have a comment or questions of Dr. Gellert? Okay, great. Hearing none. Thank you very much. Equitable Quality of Life Subcommittee, Mr. McShepard.
Yes, I would echo the comments from both India and Heidi regarding the two meetings that we've all been a part of, the South Asian Justice and Equity Group and the Department of Child and Family Services. Those were very, very interesting, very powerful discussions. I, just as an example, remember writing down a stat that the Department of Child and Family Services reported that 67 to 70% of all the kids that are taken into custody are Black. So here we are again, you know, yet another major quality of life indicator, kids being taken from homes, and we see it's disproportionately affecting, African-American communities and families. So all the more reason to continue to have these kinds of meetings and conversations. There were a lot of intersection points, I think, with all 4 subcommittees as we talked with that board. And it made me think a lot. One question I asked that the co-chairs might remember, the director was saying that CACE workers have a mandatory 36 hours of training per year. And I asked, is that the case throughout the state of Ohio? Is that a rural caseworkers training? The answer was yes, that's the statewide policy. So I said, well, seeing that Cleveland is the poorest city in America for children, and we have this long list of challenges, and we know there's a lot of trauma, is 36 hours really appropriate for a caseworker in Cuyahoga County? Should it be more? So those are kinds of things that come about from these discussions, but those were quite fruitful, and I look forward to maybe following up with both of those groups in the future. Since our last formal meeting, I also had a conversation with Jeff Patterson from CMHA to kind of continue a conversation we had before, I think, Eddie, that you were a part of with the larger housing coalition, and also had a chance to speak with Sarah Parks Jackson, who's heading up county housing initiatives for the county. And we have some good ideas about ways we can work together. Personally, based on those conversations, I'm really zeroing in on the pay to stay legislation, which is gaining a lot of momentum. Lakewood, I think, is the latest community to pass that legislation. There's several others that have done it or are thinking about doing it. Also, the income source protection is something that Jeff Patterson talks a lot about at CMHA, which I think would warrant some additional time from our subcommittee. And the last thing I'll say, to be honest, one of the reasons I was asking about when we will sort of look at replacing someone like Phyllis is that my subcommittee is small but mighty. There were only 3 of us to begin with, and Phyllis was one of them. So it's down to just Victor and myself. And there's a lot of things going on, a lot of meetings going on. And I was glad to hear you say, Chairman, that you weren't expecting nearly as much in terms of the report writing this time around, because the bandwidth might be a bit tethered. But no, it's been a successful, last 6 weeks or so, and looking forward to being in touch about maybe making some formal recommendations to the county about possibly moving forward with one or both of those policy recommendations, pay to stay and income source protection.
2 important policy shifts if they can be acted upon. And Randy's point reminds me that even though we have separate subcommittees, you're free, of course, to sit in on any discussion. I think Laura and Naila have done a good job of putting the schedule out for everyone to see and review. So you don't have to be beholden really to one subcommittee. That's where your anchor is, I would suggest. But it does make a difference if you can hear conversations that are happening across the various subcommittees to not only inform the work, but your thinking as well. So feel free. So we should probably have a little bit more fluidity to this process when it comes to who sits where and who listens to what as time goes on, in addition to adding at least one more member when the time comes. Any questions of Mr. McShepard?
Eddie, this is Danielle. I do have a quick question. Randy, was there any specific call out for families that had a parent that maybe had mental health issues as we were talking about the rate of children being taken from the home?
I don't recall that. I would ask any of the other co-chairs if you all remember anything specific to that point.
So I believe that there was a discussion about a higher rate where there are comorbid issues of behavioral health and domestic violence. Like there's a lot of intersectionality there. We did ask for some data, which we were told we would be able to get, de-identified. So I'm hopeful that we'll be able to get that sooner and we'd be able to share with, the other members kind of what those data look like.
Yeah, I definitely remember the domestic violence being talked about, but they claim they have just about every data point, Danielle, that we could ever ask for. They said, you know, they're happy to share it. So we'll be sure to pass along to you that data when we get it, or maybe the full case, just so that we can all go through it. I think it would be very worthwhile.
Thank you.
Any other questions? All right, thank you. Mr. Cavanis.
Thank you, Mr. Chair. So just like the other co-chairs, just trying to work through follow-up meetings with a number of parties. You know, certainly benefited from the joint meetings with a couple of the organizations that Randy mentioned, but we met with 2 individuals directly related to economic opportunities. Our subcommittee did. Lenora Lockett, that was a follow-up meeting from last year. You know, I would say just the general spirit of the conversation, the committee was very pleased with the conversation, and you know, she's you know, certainly an asset within the county. You know, understanding what's needed with the executive orders, with the changes, which is, you know, rolling out as the months go on. But one of the follow-ups to that conversation, though, was allowing one of her staff members to attend, and I don't think Janice is on, to attend one of the procurement sessions that HBC had scheduled. And, you know, the hope was really to at least give folks a heads up on some of the changes that will be happening for the positive. I believe that did take place already, and hopefully went well. I was hoping Janice could maybe share some feedback from that. So that was an excellent conversation. The second one was with David Feinerman. We did not get to meet with him last year, but did get the chance a few weeks ago. Again, another very positive conversation. When you think about, you know, all of our engagements with county leadership, you know, we probably see, you know, different folks coming from different places when it comes to equity and inclusion. I think these 2 individuals get it. So I want to give them credit for that. It's still a lot of work to be done, but certainly good partners when it comes to giving us information to help inform future recommendations. So that's related to the meetings. A couple other topics. The first is around just general comments from our committee. The first is related to, I think, last committee meeting, I believe Janice brought up the stimulus CARES Act, and you know, the county executive is not here, but I'm curious if anyone could share. We can maybe table this for next conversation. The recent stimulus that was passed in the local government, I think it was $250 million that was given to Cuyahoga County. If we could maybe get some more information around that and what the county intends to do with that. And then the second piece was around Ted Carter and his departure and the plans for that, and if we could sort of play a role in if it's filling that, if we could provide candidates for that process, if the county executive intends to backfill that position. So I don't know if anyone from the county wants to respond to those, or if you can respond to those.
So I can respond with a non-response, but I can respond with the fact that I will definitely talk to the county executive and communicate both of those questions to him, and get you an answer, Stephen, for both of those. And the first being the recent CARES dollars, and the second is what role can members of your committee or subcommittee play in the hiring of the new Ted Carter, as we call it. And even anything from providing, as you said, candidates to sitting into the selection committee, et cetera. So I will definitely, I'll talk to Armin about that, and I'll get you back something in email. Just give me about a week or so. Sometimes it's easier for me to go over to find Armin than communicate with him. So I got to wait till I'm over at the admin building. Okay.
Thanks. Wonderful. Thanks, Naila.
Add one thing about the federal stimulus. There are active conversations with our consultants who are, need to understand what the money can be spent for and what the parameters are. And that has not yet been clearly defined. So that is the first piece of what needs to be defined before there can be any decisions.
Okay, thank you. I appreciate that. And lastly, just in terms of what we're seeing across the United States when it comes to equity, just paying attention to some of the news around Evanston, Illinois, with the recent reparations legislation there. And for some that might know, last year, I believe Stockton, California, is piloting the universal income pilot. So just paying attention to that activity to see how it develops and how it could play into our work. So with that, I'm not sure if anyone else on the committee wants to share thoughts.
All right. Well, thank you, Stephen. Do appreciate it. Habiba, we're not going to put you on the spot, but if you certainly like to say something about communications, your half-hour, length strategic plan overview, you got it all figured out. Certainly feel free to do so. But I'll give you a moment to think about it. I'll ask.
Before that, Chair Taylor, I did want to just comment on Stephen's last kind of little piece there, the following of what's happening around the country in regards to reparations and strategies around how we address the harm that is historic at the same time as preventing and reducing harm from repeating itself. So I just want to offer that. I'm eager for us as a council to have that conversation and look at the intersections where those kinds of plans can disrupt some of the health outcomes that we are concerned about, but also the other areas.
So say more, both you and Stephen, say more when you talk about the work that you'd like for us to consider. Can you expound a little bit on what it is you're thinking?
Yeah, I think the opportunities that are emerging across the country in different municipalities in regards to repairing the past harm of systemic racism through economic development drivers that are really centered on infusing dollars into the households and lives of people impacted by racism is something that I would hope we would, as a region, as a county, be able to explore, both study in terms of possibilities, but also in terms of potential impacts, and looking to how we disrupt some of those outcomes that we're trying to disrupt through policy change and reform more directly or explicitly through reparations programs.
Okay, all right, it's clear. Anyone else have any thoughts along those lines or questions?
I would just encourage us to have that conversation sooner rather than later. I think it's important. It's cross-cutting across all of our subcommittees. And I think both Habiba and Stephen for bringing it up in this public forum.
Agreed. Okay, so I'll ask those that remain, what else, right? What else as a committee?
Chair Taylor.
Yes, please.
Yes, I'm sorry. Also, just to share with you, the work at the city level on the RAFC is also having similar discussions around those issues.
Okay, thank you. So as I was saying, what else should this council be talking about? This was an important component just mentioned by Stephen and Habiba. Anything else we're missing that we should think about adding to the agenda? I'm understanding we of course have constraints to our work. Those things we can tackle. We want them to reside under these 4 pillars, but the charge is pretty broad, right? For this group to look into and explore. So if there are other thoughts before we move to the final few sections of our agenda, I'd love to hear, even if it's just an ideation, we have to be careful about it, but an ideation process, recognizing that we're in a public forum. But any other thoughts or comments from folks that you want us to consider as a Citizens Advisory Council, right? To advise the community on these issues as directed and legislated by the county. Any thoughts?
Chair Taylor, I think it's just important that we simultaneously consider these bigger picture systems and structural potential interventions, which we could suggest with also meeting needs in the moment. And you know, going back to our COVID-19 vaccination discussion, and clearly there are issues that we need to address from an anti-racism and equity perspective now and in the moment, and people are suffering and we need to meet those needs, but we also have to balance that with the long-term needs to hit the systems and structural change. So I think sometimes it's hard to think of those at the exact same time, but I've really been wrestling with both of those within the health and healthcare sphere and really thinking about that. So if there's a way for us to talk about both and not trying to boil the ocean, as Randy cautions us, but also thinking about the longer term approach to this and recognizing the importance of healing and ongoing trauma, but also multi-generational trauma as part of the lens with which we consider recommendations.
Thank you.
Mr. Chairman, I first wanted to say, Heidi, that was well stated. Habiba's going to give me a virtual high five on this one, but I've been sort of wrestling in my mind. I know one of the categories that fall under the guise of this group is education. And I was looking at some of it was briefly mentioned in the report from Levin College about parents feeling that, you know, their kids aren't getting the proper attention and support to be the best students they can be. And with all the work I've done with public schools and serving on committees and boards, it's clear that you can't talk about the pathway of let's say a Cleveland student without understanding how trauma, lack of food access, transportation, unemployment on the part of their parents, all of those things all contribute to a more than challenging educational experience for the child. And I know we sort of early on said, well, you know, education sort of not under the direction of the county, and maybe we'll nibble at it one way or another. But I think we might think about it a bit and find out if there are ways to sort of analyze it and see that if many of the touch points that our subcommittees are involved with can in some way feedback some direction or some ideas that might help or improve the plight of our kids in this community.
Very good. Very good. She did give you that virtual high five. That's cool. Very, very nicely done. All right. So noted. And I agree. Any other comments? Thank you both, Heidi and Randy.
Chair Taylor, I think Sheila has her hand up.
Oh, Sheila.
Oh, thank you, Chair Taylor. Thank you, Heidi. In terms of just other things to consider for this group, ideation, if you will, I think I've mentioned this before with respect to the investments around the innovation district, amplifying conversations around equity with respect to that investment, and how that's rolled out in terms of where the district is, you know, how it's designed, what the investment dollars are looking, the impact of the dollars in terms of jobs that they want to create, the type of businesses that they want to support. And so I think that this committee could let, you know, and again, understanding the parameters in which we exist, but if we could leverage the weight of this committee to push those conversations, I think that's a worthwhile effort. I also think another thing that might be worth some consideration, I don't know if it will fall under economic development, but you know, if you take a look at the number of people who are currently at risk of losing their homes now because of their water bills, and people not understanding how this is going to continue to scale. This has been something that our foundation has been working on for several years now. As most of you know, I'm sure we are under a consent decree with the EPA. And the EPA gave us a certain amount of time to treat our water. And the cost to treat our water, that cost is being transferred to residents. And I think it was a $30 billion price tag. I don't know if you guys have, I can send you the information, but we are in the height of that bell curve for that cost. And if you go and look at the number of people who are going into court now and who are at risk of losing their homes because of their water bills, and it will again continue to scale, that is a problem that I don't see a lot of people looking at. And we are providing capital and resources to people who are who are in jeopardy of losing their homes because of their water bills. That needs to be addressed. That's a countywide issue. And then I think the last thing which we talked about is affordable housing. I'm just looking at the various projects that are coming through here in Cuyahoga County in terms of real estate and the sources to bring those projects to bear. And I just think that we need to take a closer look at what are the opportunities for even private developers to, to think creatively in terms of their sourcing and offer more affordable units for people.
Okay, thank you for that, Sheila. So I've heard a few things, and it's how the communities can impact the need for paying for, in so many ways, past misdeeds that communities have and the atrocities committed against Black and Brown folks. So I've heard that as a part of the discussion, the educational component of it, especially given more recent studies. We've also heard the multi-generational impacts of health and healthcare, so the big picture process that Heidi mentioned, investments in and around the innovation district, the issues around costs, especially with our water systems and the decrees and such we find ourselves under, and then housing. Some of these things are covered in other areas, but all good discussions. I want to make sure I didn't miss anything in terms of the ideas thrown out or somehow mischaracterize them.
This is Danielle. Last thing I would add to that is, as we've talked about how much of this work will be mostly internal facing towards the county and its systems initially, just really how do we make sure this information gets institutionalized and pushed down to anyone who's getting any money from the county for anything, starts to adopt some of the best practices and learnings and mandates and whatever is going to come through CACE, because there's a certain amount of business that takes place with resources directly inside of the county, but we know the county is a pass-through for a lot of things. You have a lot of organizations that are funded, and if they're not adopting the same sort of hiring standards or equity and all of that, I think we won't have as much of an impact on the community as we might desire.
It's an important point. Where does the money lead, right? And who gets funded and how are things paid for, and which businesses are supported that do business with the county if they are not doing business in a way consistent with what we think are the best ideals. So I hear you 100%. Okay. All right, I will pause there. Naila, before we end, and I'd like to, well, I'm sorry, Habiba, any comments on the subcommittee for communications?
I will be following up on this call with you and Naila in terms of future leadership. In terms of the committee itself, I think Eliza's update was really comprehensive. I think our focus has been deeply on the issue of youth. We need to reconvene. There are some hopes coming out of the Economic Opportunities Subcommittee, and so I would be eager to have any new folks join us, and we'll again follow up quickly regarding leadership. I think we have some work to do that we have kind of not been able to do in recent weeks that we could hopefully get started and move forward in terms of communicating with small business entities, minority-owned businesses around the executive orders of what that means for them and the opportunities that are to come. And we want to do that in a timely way.
Mm-hmm.
Yeah, that was an idea that was born out of a prior conversation. You're right. We should make certain we follow up. Good. All right, Naila, can you give us a brief update on the GARES work before we finish with Dr. Hoffman?
Sure, of course. So as explained in our last meeting, GARE is a national network of government agencies working to achieve racial equity and advance opportunities for all. GARE, quote, leads with race, close quote, and believes the creation and perpetuation of racial inequities has been built into government policies and practices. GARE provides tools to put theory around racial equity into practice at a local level through the use of national best practices. Laura and I are participating in the monthly membership meetings as well as the regional manager drop-in hours. The February monthly membership meeting included a presentation by the GARE Steering Committee. The Steering Committee provides input on GARE's work plan and the organization's approach for tracking progress. The Steering Committee also provides strategic guidance on the sustainability and effectiveness of the GARE network. The meeting included regional connection breakout sessions, which allowed members an opportunity to provide updates on their work in the racial equity space. The GARE annual membership meeting, or their annual meeting, was also discussed. It's scheduled this year because of the pandemic to be a virtual event from May 19th to May 21st. Laura and I have both registered to attend, and I will be reporting back after the meeting. The March monthly membership meeting included presentations by 3 GARE representatives participating from the North Carolina cohort. The representatives discussed equity initiatives in the cities of Raleigh and Durham and in Orange County. Details regarding each jurisdiction's equity departments and DEI training for employees was provided. Orange County also provided a presentation on a data collection program they're using to track equity metrics across departmental and jurisdictional lines. The data will be available for the public, which includes nonprofits, who will use the information to apply for grant opportunities. The 3 speakers from North Carolina all highlighted the need to build capacity and buy-in for equity initiatives, the importance of measuring success, the need for data, and the importance of engaging the community in this critical work. Are there any questions? Okay. Moving on then to Dr. Hoffman. As all of you know, Dr. Hoffman is continuing to meet with the subcommittees to talk through the topic area systems maps, and he's starting to map solutions and leverage points based on these discussions. He also intends to create a simulation model to be used for thinking through scenarios. During the Equity Commission's March 18th meeting, Dr. Hoffman presented an overview of his work with the CACE. The presentation was well received by the Equity Committee members. Dr. Hoffman, thank you for your partnership, and you now have the floor to provide an update on the progress of the systems mapping.
Thank you very much for the, I don't have slides, so this would just be a brief update. In addition to the meetings, continuing to mapping the interviews as you're doing them from the subcommittees, the meetings with subcommittees they were really helpful in terms of providing feedback and suggestions, both in terms of identifying more linkages across the maps as they're developing, in addition to working on developing some communication toolkits, briefs that could help support the use of the maps and conversations as you're having them. The mapping of solutions and recommendations as they're being generated, and they will go into the map. And then also, Heidi mentioned the continued work. This includes developing a way to think about how we might measure systems change. In particular, being able to pay attention to when there are early indicators of changes in the right direction, and being able to attribute them also then to changes in the outcomes. And the last point I would point out, just sort of following up in the conversation today, is that in terms of working on some of the issues around K through 12, there's quite a bit we can actually draw on from prior work in both in terms of systems mapping, but also engaging young people and students and teachers in K through 12 if there's interest with the systems mapping.
Good, work continues. And I think the subcommittee chairs and the committees agree as well. Once we had a chance to bring it closer to earth, right, for those committees to see the work it made a profound difference in their thinking and how this all sort of plays together. And we've heard the same thing from other groups. So groups outside of CACE who have congratulated us for using systems thinking in the approach, because we recognize that all these things are interconnected, and the levers that are pushed or pulled in one area certainly can affect other areas. So the more we spend time around it and apply it to this work, I think in the long term, the better off we all are, because this has to endure beyond our efforts here, right? It has to be picked up by someone else at some point, and the work should continue until problems are solved. All right, Clerk Byrd, anything we're missing other than next meeting dates and adjournment, unless there are other questions from folks?
No, there's not.
Any other thoughts, comments, or questions?
Eddie, this is Danielle. I hate to delay our time, but Nyla, I know you always start us off with a moment of silence, and I can't help but reflect on the fact that Dante Wright was killed.
Danielle,
right
I thought about doing that this morning, and I had already prepared the other one, but please.
I know, and you know, as this has been happening, I've been trying to pay attention, but the press release came out that the officer said it was an accident, and he thought it was his taser.
I think it was a she, right, Danielle? Wasn't it a female?
Yes, I'm sorry. It was her taser. And so I just think as we continue to talk about why this is so important, it's the human element. And I get emotional because my son is 18 and that could be him, and it could be an accident. Well, we can't accept it. We've got to move faster towards getting this right. And so I would just ask us to have a moment of silence for Dante's family, because that could be any of our children that are faced in the same circumstance.
For those of you, before that moment of silence, for those of you who don't know, Dante Wright, as Danielle Sidnor said, was a 20-year-old African-American man who was fatally shot by a woman police officer within 10 miles from where the Derek Chauvin trial is currently happening. He was allegedly pulled over because he had an expired license tag. And the police officer is claiming that he had a misdemeanor warrant after she ran his name. And again, as Danielle said, shot him dead on the street. So yes,
we will honor that request for a moment of silence at this point. Thank you, Danielle, for bringing that to our attention. Thank you, everyone. Yeah, a solemn way to end, but it's still the fight. It's still the work. So thank you, Danielle, for reminding us of why we're here and why we're doing what we do, because it's the humanity of it all. These are our brothers, our sisters, our kids, our neighbors, our friends. So we have to endure. Anything else from the group? All right, thank you all so very much. Enjoy the rest of your week.
Can I just, I'm sorry, Chair Taylor, I apologize. I just wanted to let the members know that the next meeting is tentatively scheduled for May 10th from 1:30 to 3:30. We discussed having a sort of cadence to the meetings, and we decided that they will generally take place on the third Monday of each month, obviously subject to change, but the next third Monday, or the next one is not taking place on a third Monday because it's taking place on May 10th from 1:30 to 3:30.
And what I will say as well, while 2 hours is not, all the investment in the world, if we're going to do these monthly, let us get back to you. Perhaps we can, shorten this time together and be more efficient with our reports, because it'll just be a month from now, and maybe the reports will have some other detail to them. But I think there's probably, if we're going to have this cadence, an opportunity to shorten by at least 30 minutes the length of these meetings. Okay, we'll look into it. All right. Thank you, everyone. Appreciate it. All the best, Eliza. All right.
Good luck, Eliza.
We will miss you. Okay.
Guys, I'm not going anywhere. You can still find me.
It feels like we should say that, so we have.
Okay, thank you. Bye.
Right.
Thank you all.
Bye-bye.
Take care, everyone.